Every hospital leader claims AI is transforming care. But how do you actually tell what's working from what's just hype? Joe Avelino is the CEO of College Medical Center in Long Beach, California. It's a behavioral health and acute care hospital that has intensive outpatient psychiatric care programs, including a psychiatric care for boomers and the elderly program. Joe is a CEO who's been a nurse, a soldier, and a hospital executive, and he's passionate about leadership. Today, we're going to talk about his approach to evaluating AI and implementing tools so you can adopt with confidence instead of guesswork and without losing the sight of the resident. This is AI-powered caregiving by Zemply, the podcast exploring how technology is reshaping how we care for older adults. I'm Aparna Pujar, the founder and CEO of Zemply. And without further ado, welcome, Joe. Excited to have you here on our podcast. Before we start, I would like to have you take a few minutes and tell us about yourselves.
Thank you for that introduction, Aparna. My name is Joe Avelino. I'm the CEO of College Medical Center. Been here for, its inception since October 9, 2013. Excited to have this interview and how we've initiated, and come into execution with regard to our AI implementation here at College Medical Center. Look forward to the discussion, Aparna.
Great. I'm excited to learn more about what you all are doing. So College Medical Center runs a dedicated geriatric psychiatric programs, psychiatric care for the boomers and elderly. Before we get to AI, what does the current care gap look like for older adults with behavioral health needs? And what are you seeing out there in the marketplace?
Well, Aparna, resources are there, but there's the challenge of shortage of beds and sometimes sitters to watch over their older adults. There's also the difficulty of managing dual diagnosis, med-psych elderly patients with comorbidities and complexities. Not many facilities like College Medical Center are able to care for the highly acute psychiatric patients with additional comorbidities needing, for example, dialysis, wound care, diabetic care, neurology consult, orthopedic consult, just to name a few.
Yeah, that is indeed the reality of caring for older adults. And as we know, every day 10,000 people are turning 65 and over. And this problem is not only just getting complicated, but it has always been complex. So the combination of complex plus complicated, throws a completely new set of dimensions into how you care for the elderly. You've seen care delivery from different seats through your career. When you hear AI in caregiving, what instantly goes through your mind? I mean, what are you thinking about? Is that a good thing, or you think, oh my God, no, this is another trouble tech coming at me?
Well, let me first preface that we're still in the exploratory phase of AI at College Medical Center. Our goal is to begin introducing AI capabilities over the next year, although broader adoption will likely occur in 2027 due to budget priority. AI will undoubtedly become an increasingly important tool, helping us identify patients at risk, improve access to care, streamline administrative burdens, and support better clinical decision-making.
My next question is about care delivery, and you've seen care delivery from different seats throughout your career. When you hear AI in caregiving, how does your experience shape how you evaluate it? I mean, are you curious about it? Is it something that you would rather push off until it makes sense? What are you seeing both in your organization and sort of like the feedback from your teams as well?
Thank you for that question, Aparna. Let me first preface that we're still in an exploratory phase of AI at College Medical Center. Our goal is to begin introducing AI capabilities over the next year, although broader adoption will likely occur in 2027 due to budget priorities. AI will undoubtedly become an increasingly important tool, helping us identify patients at risk, improve access to care, streamline administrative burdens, and support better clinical decision-making.
Great. Yeah, thank you. And I think those are the areas where we're seeing a lot of market adoption, especially in the healthcare with respect to AI and the value it is proposing it will deliver. What do you hope to anticipate, or what are you anticipating in terms of deliverable, measurable productivity gains? I know you're still in the experimental phase, but do you have any early thoughts on what are your expectations? What is sort of the one thing that you want to see happen using AI or AI-powered technology?
I can give you four examples, Aparna. First, Cerner AI, our EMR is Cerner, where we are evaluating AI capabilities within Cerner, such as AI assisted clinical note generation to help reduce documentation burden for clinicians. That's number one. Number two, utilizing Microsoft Copilot. College is partnering with a company called SoftChoice to implement Microsoft Copilot to improve employee productivity, collaboration, and administrative efficiency. Third, we have what they call an AI generated plan of correction, where we collaborate with a company in Northern California where one can upload your 2567, which is the findings, recommendations from the California Department of Public Health licensing agency, and get a fully drafted plan of correction. Imagine that in seconds. So no more starting from scratch. With the immediate turnaround, the team will have more time to focus on fixing the recommendations rather than focusing on writing and formatting. And last but not least, cybersecurity. At college, we are actively using AI from a cybersecurity standpoint through our Sophos security platform. AI continuously watches our network 24/7 for suspicious activity. Instead of only looking for known viruses, it can recognize unusual behavior, helping our IT team identify and stop potential cyber threats earlier. And this provides an additional layer of protection to help keep our systems, patient information, and hospital operations secure.
Yeah, I think those are some of the great examples of where AI can make significant impact, especially in giving time back to your team and your staff so they can do the job they're supposed to do, which is, caring for your residents or patients and delivering the higher level of care that I think is needed for, as you mentioned in your case, the population that is that has higher comorbidities. So our next question is about efficiency and that seems to be sort of like the overarching value proposition of AI. But efficiency and dignity can pull in opposite directions. A faster process isn't always a more humane one. How do you personally evaluate whether a tool is actually improving the resident's experience versus just improving a KPI or a metric?
An example for College Medical Center is scheduling appointments with our detox patients with alcohol, benzodiazepines, or opiates addiction, where we utilize what we call Grace AI to prioritize availability so patients don't have to wait in the emergency department and also to ensure the patient has a bed capacity if admitted. College also utilizes Tiger Connect, which is a secure, HIPAA compliant clinical communication and collaboration platform used by healthcare organizations to enable text messaging, voice video calls, and automated workflow alerts. Through Tiger Connect, our medical staff office is able to distribute the new online physician on call schedule for our residents. And this AI capabilities automate scheduling creation, identify coverage gaps faster, and make it easier to fill open shifts for our providers to manage the residents.
Wow, that is an impressive list of tools. I'm sure our audience is going to be very excited to hear about all these tools. And for the audience that's out there who are looking for examples of what to start, how to start, and where to start, this is a great list of starter tools in AI. Pretty essential, but I also feel like pretty harmless in terms of kicking off and running your own experiments with AI. My next question is about just the experience of rolling out AI tools. Rolling out new AI tools is its own kind of adversity, especially with the clinical staff. You might be faced with skepticism. There's disbelief, certainly, that we see in many respects. Obviously, while the AI's value proposition is in workflow improvements, there's also a disruptive initial disruption that happens in the workflow, and there's fear of replacement. So how do you lead the team through all this, and what has been your experience now that you've tried a set of technologies that are using AI to directly impact workflow and workflow efficiency? So rolling out new AI tools has its own kind of adversity inside an organization, especially when it comes to bringing your team along in terms of adoption and implementation, especially the clinical staff. There's skepticism. We've also heard fear of workflow disruption, fear of replacement. So, how do you, as a leader, lead your team through this? And what is it? What about your leadership style has helped you address some of these concerns that your team might have?
As a leader, you show the direction and trust people with the how, and then let performance happen. Why do so many leaders believe they have to carry everything themselves? Leadership becomes exhausting when every decision, every solution, and every outcome depends on one person. People do their best work when they understand they're going, where they're going and why it matters. Once that direction is clear, they need trust more than instructions. The role of a leader in implementing AI is to create clarity, remove obstacles, and build an environment where people can contribute with confidence. When people feel trusted, they stop waiting for permission. They take ownership, they grow. And the strongest teams are built through clarity, trust, and shared purpose.
I think you hit it right on the points. Right, you hit all the right points there, especially with respect to building trust and providing clarity to your team. So important in today's day and age when we're getting exposed to so many different aspects about the AI and the technology itself. So let's take a small deviation here. I recently heard your podcast on Becker's as well. And in your Becker's Leadership Unscripted interview, you mentioned that you used your military experience to learn about discipline, but healthcare taught you flexibility and collaboration. As AI enters healthcare, how do you see this working for you and your team? But also, what is something that you want to share with the other leaders and other practitioners out there who are possibly contemplating or maybe in the same situation as you are?
Let us never confuse technology with humanity. Artificial intelligence can analyze data, recognize patterns, but it cannot replace the healing power of a compassionate physician, a reassuring nurse, a dedicated social worker, or a sitter who simply sits quietly with someone during their darkest moment. Think about this. Our patients may not always remember their diagnosis or the medication we prescribe, but they will remember how we made them feel, whether they were treated with dignity, respect, and compassion. As we embrace innovation, let us ensure that technology enhances the human connection rather than replaces it.
Thank you for that. I think that's a very helpful piece of advice. And being on this side of the ecosystem where, Zemply is a technology vendor, we're constantly striving to ensure that when we work with our customers, which is, people like you, we are paying attention to the humane aspect of the care. And I feel like healthcare is possibly the one industry that is actually going to define what it's like to blend AI with the humane aspect of anything and everything related to AI. As AI is disrupting every aspect of our life, how do you still keep that humaneness embedded into everything that we do, what we do for ourselves, and not just for ourselves but our societies? So in your career, you must have evaluated, hundreds of technologies. What are like a couple of things that you look for in a technology or a vendor?
Number one is the collaboration. I mean, technology can only take you so far. And there's the humane aspects when you have efficiencies. And I was just dealing with an AI company just a few hours ago, looking at our process and our submitting our claims with Department of Mental Health, and the possibility of eliminating positions. And as a leader, because of the AI efficiency process, making it more collaboration. How do you manage it so that you can also, as you improve the technology, you're probably going to eliminate positions you no longer need, and be able to treat the transition over with AI. And obviously, in some situations, you would have to let go of employees, and treat it with a bit of grace and a bit of dignity and pride in the organization. So I'm looking for a partner that has that human component as well, and not just thinking about technology, efficiency, and AI.
If you had one message for aging services leaders who are AI curious but resource constrained, what would that be?
I would come there with a be open minded, and sometimes even me coming from a older generation, it took time for me to come to acceptance. But take time to listen. Take time to listen. Sometimes, what is it? Stephen Covey once says that seek first to understand, then to be understood. And change is always a challenge. It's the only thing that's constant is change. But take that opportunity to be open minded with AI.
Yeah, that is a valuable message, isn't it? I mean, we all have to remember that change is constant and it's always evolving. So an open mind is always a great strategy, in all aspects of life, whether it's work or personal life. And last but not least, if you could wave a magic wand and change one thing about aging in America, what would that be and why?
If I had a magic wand, I would change America's perception of aging. Aging should not be viewed as the beginning of a decline, but as a stage of life deserving of dignity, purpose, and continued opportunity. As we embrace innovations like AI, we should use them to enhance, not replace the human connection. AI has an important role to play, but AI can also help us identify health risk earlier, coordinate care more effectively, and give clinicians more time to spend with patients. However, we must never allow technology to replace human compassion. The true measure of our healthcare system isn't how long people live, but how well we help them live with independence, empathy, and respect.
Yeah, that is indeed a very valid point. I think what we all want to see is a change where our relationship with aging, or the society's relationship with aging, has to drastically change. Especially, right now in the world, as the world is getting over, right? In another 25 years, one in every five person will be about the age of 65. So I think it's important that we start looking at that very seriously and understanding how we create a society and an ecosystem where people of all ages thrive and have a great life. So we're coming to the end of our podcast session here. As a last part of the thing, we often do this fun thing where we ask our guests to recommend something that they're reading, whether it's in health or any other area, or about AI and technology, or anything that they're watching that they would want to recommend to our audience.
Aparna, I'm more into reading about leadership and personal development. And one book I would highly recommend is Simon Sinek's Infinite Game. A little quick summary of Sinek. What he indicates is that finite games, they have fixed rules, known players, and a clear endpoint where a winner is declared. For example, football, basketball, or even chess. With an infinite mindset, in what Simon Sinek is indicating in the infinite game, is you focus on growth, innovation, and sustainability to stay in the game rather than a mindset of crushing your competition.
Yeah. Oh boy. I'm a big fan of Simon Sinek, and I love this book. And nowhere is this philosophy of infinite game more applicable than in healthcare. Given the complex nature of the industry, the different kinds of people involved, I think having that mindset to even understand what healthcare is all about is fantastic. I mean, that paradigm applied to healthcare is such a match. It's been a guiding force for me as well. I'm a big fan of that book as well. So thank you for recommending that. With that, we come to the end of the program. Joe, any last thoughts or words of wisdom that you want to share with our audience?
So, just some closing comments. Technology may help us work smarter, but compassion is what helps us heal. As we embrace artificial intelligence, let's never lose sight of the human intelligence, our empathy, kindness, and presence that our residents need most. AI should never replace the human touch. It should simply give us more opportunities to provide it. In the end, our greatest innovation will never be the technology we adopt. It will always be the humanity we preserve.
Is very well said, and thank you for that. I think we would our audience, and especially I, completely appreciate that word of wisdom that you shared. We hope that everybody who is listening to the podcast and who will be listening to this down the line will continue to keep that as the primary takeaway of this conversation. Thank you, Joe. It was a pleasure having you, and all the best with everything that you do. I wish you all the best with all the technology implementations that you're working on. And hopefully we'll come back together in a few months to just learn more about what your experience has been and the progress that you've made. On behalf of me and Zemply, I wish you all the best and thank you again.
Thank you for the opportunity, Aparna.